Good afternoon. Thank you for joining us today. My name is Janice Butchko, Senior Project Manager for the MDS Foundation, and I will be moderating today's webinar. Thank you to our sponsors, AbbVie, Bristol Myers Squibb, Servier, and Tayo Oncology for supporting this webinar program. Today's webinar will be presented live. There will be a question and answer segment for all participants at the end of the presentation. Today's presenters are Tracey Iraca, Executive Director of the MDS Foundation, and Ashley Moncrief, Director of Patient Care. Tracey joined the MDS Foundation in 2004 as a part-time patient coordinator, assisting with patient education programs. As Executive Director, Tracey now oversees all daily business activities, including finances, staffing, and projects to support the mission of MDSF. She works with the MDSF Board of Directors on strategic planning for meeting the ongoing needs of MDS patients and healthcare professionals. Tracey manages the Corporate Grants Program and is responsible for all corporate relations, organizational partnerships, and new business development. Ashley joined the MDS Foundation in 2023. She has 12 years of experience as a malignant hematology nurse, including 5 years in clinical research. Ashley came to the MDS Foundation from Vanderbilt, one of our MDS Centers of Excellence. She first became affiliated with the MDS Foundation in 2019 when she spoke at one of our patient forums in Nashville and was selected to be on the MDS Foundation Nurse Leadership Board in 2020. She now serves the foundation by being a first point of contact for patients, building the Centers of Excellence community, and heading up the Nurse Leadership Board. It is my pleasure to introduce my colleagues, Tracey Iraca and Ashley Moncrief.
All right, go. Hi, everyone. I'm Tracey Iraca. Thank you, Janice, for that introduction. I'm really excited to be here today to share more about what the MDS Foundation does and who we are. Thank you so much for joining so that you can learn that. As Janice mentioned, I've been with the foundation. I joined in 2004, so November is my 20th year, and it has been such an amazing experience, and I'm excited to share some of the things that we do with you, and just a little bit about who we are and how we came about. So we are actually in our 30th anniversary this year. The foundation was started in 1994. It was started by a group of physicians working with someone who had a medical education company. And they immediately saw a need at that time for MDS to become more prevalent and to have someone who would support the patients and also educate the professionals, which I think is something that makes us unique, that we do a significant amount of patient and family support. That is our primary goal, but we also do a significant amount of professional education. And I love that we're able to do both of those things and to support our mission, which is officially supporting and educating patients, their communities, healthcare providers, and contributing to innovative research in the field of MDS and its continuum of diseases to better diagnose, control, and ultimately cure these diseases. So it's a lofty goal, and our vision is to ensure that every MDS patient will benefit from our initiatives and our research as early as possible. That has been a challenge. If I'm going to mention something that's challenged the foundation in the time that I've been here, it's the fact that people don't know we exist. And if we do, many times it's once their disease has progressed quite a bit and it limits the amount of help that we're able to provide them. So one of the goals of this webinar is to reach more people and to let people know upon diagnosis that the foundation is here to help in so many ways. So Ashley will talk more about all of those ways later. But we are officially headquartered in New Jersey, but we are a global organization. We work worldwide. We have a staff of 7, which is a relatively small group. You can see them all listed on our website if you go to About Us and Staff. It's worked for us to have a smaller team. We are slowly growing, but as I mentioned before, we work in patient support and education and research. So I oversee all of the staff and the projects that we work on, but we've got Ashley and Janice who work primarily in our patient education. We have Leah who works primarily in professional education. We have Tanya and Madeline, and they work in marketing and development. And then we have Amy, who is working more in office coordination and database coordination. So those are our 7. Excuse me. And I can talk a little bit about our structure and the way that we are able to do so much with such a small staff. We're really fortunate to have a large leadership board structure. So we've got our board of directors that is made up of still some of the physicians who started the foundation 30 years ago. And those physicians help to guide us in governance ways, but also in the medicine and the medical research that we do. We have an official medical and scientific advisory board. That's a group of about 18. Both of these boards, actually all of our boards, are global. So they are they are people worldwide, physicians worldwide. There are about 18, I think, on the MSAB. We've got 6 on the board of directors. You can see those boards on our website as well. The newest board is our development board. So that board is made up of patients and caregivers and a couple of physicians who help us to really understand how we can get the word out for awareness. They help to work on our walks and which is our main awareness initiative, and how we can fundraise so that the foundation is able to do what we do. We've got a nurse leadership board. Ashley may discuss the nurse leadership board a little bit more later, but the board has been in existence for many years, and we've got nurses from all over the world. It's been wonderful to have all of these boards as a resource for the foundation. Many of the doctors and nurses who belong on these boards actually do assist us in doing webinars and in reviewing our materials and making sure that we're on the right track when we put together a new project or we put an agenda together for an ASH symposium, for example. These are the boards that kind of double check our work and make sure that we are going in the right direction. We wouldn't be able to do what we do without them. We also have an excellent Center of Excellence program. You'll learn a little bit more about that program from Ashley. She runs that program, and it's been in existence since I started. So it's been quite a while, and it grows. We are constantly adding new centers to that group. We're, I think, around 200 now, both in the US and outside the US. The physicians and the nurses who are part of that Center of Excellence program also do a lot of work for us. They help translate our materials. They help with, again, reviewing to make sure that we're on the right track, to make sure that we're really understanding what is happening around the world and ways that we can continue to improve our outreach. Leah also manages our research. So we support young investigators as often as we can. Right now, we're doing so probably a couple of times every other year. That will be in conjunction with our international Congress. And we have application process where there's a review committee and the young investigators can apply for the funding. It's a significant amount. It's $100,000 per project. That is given to them across 2 years. So when we have the funding to do that, we are able to continue that process. So far, we've been pretty consistent with all of our, with giving in the research area. We have some supporters, family members, who also give funding that will go directly towards young investigators at that Congress. So research is quite important, obviously, to us as we look into new ways that we can help treat patients and ways that we can continue to look at MDS and slow the progression, of course, and also make life easier on patients. A huge effort is made for quality of life, understanding exactly what patients need and other caregivers as well. So it takes a village, and we're really fortunate to have a nice big village of supporters, and our industry partners are fantastic in working in collaboration with the foundation to make sure that the patients are getting everything that that they need. So I would say our biggest challenge, as I mentioned in the beginning, is just letting people know that we exist. And I can honestly say I didn't know that before I started. I didn't know that groups like the foundation existed to help people along the path. But if we can get to folks as early as possible in diagnosis, I promise we can make a difference. And that is our ultimate goal. So I'm going to stop now, and I'm going to pass it off to Ashley, who will talk about exactly what we do to achieve our mission and our vision and our goals for patients and for professionals. Thank you so much.
Hello, I'm Ashley Moncrief. Tracey did a fabulous job. I'll do my best to live up to my introduction. Let me pull up. I am going to share my screen. I created a PowerPoint, and we can give this to you after. Okay, so it should be there. Let's go from beginning. So MDS Foundation. So our motto right now is the people who make hope work. So I will say, coming from a center of excellence, I spent almost a decade there, and having been affiliated with the Nurse Leadership Board, I still didn't know what we did. So I thought I knew what we did, and now I'm glad that I do. So I just want to share kind of what we do for all three of our pillars. So we do have three pillars. It's patient, professional, and research, and Tracey touched on that. So you can read the mission, and we'll send it out to you since she gave that to you. But our first, I'm just going to give a little bit of a synopsis of some things that fall under each of these pillars. So patient, we started keeping metrics to see how many patients that we actually talk to. So this includes patients, caregivers, family members. We're averaging about 400 new to us people per year. Given the rarity of MDS, it's not insignificant, the 400 number. So we're hoping to see that grow. In the past year, we have talked to people from 31 states across the United States and 16 countries. And then the services that we offer, we will go over in depth, so I won't read all of that to you right now. Professional, we do host symposia and congresses. We'll talk about that. We'll talk a little bit about membership, the Centers of Excellence Network, our risk stratification calculators, our professional podcast, and then research. Tracey talked about our Young Investigator Grant. We have a clinical trial matching platform. And then we do partner with pharmaceutical companies in a way that I was unfamiliar with. So having come from the Center of Excellence, I spent about 5 years in the clinical trial space. During that entire time, I was unaware that there were patient advocacy departments within pharmacy groups. And so I'm excited to work with them in this way. So a little bit on why I decided to join the foundation. So having met them even just the first time, like their love for patients is palpable. You can feel it. And so I wanted to be part of that. And I will say, as a nurse on the floor and even in research, I was often told, you spend too much time with your patients. And so I decided, instead of changing what I do, I would go somewhere where I could spend all the time I needed to make sure people understood what they needed to know. So excited to be here. So a little bit about our patient resources. So as the Director of Patient Care, all patients are welcome to give me a call. You can leave me a voicemail on my extension if I'm on the line with someone else. You can also reach out via email. We do our best to answer all MDS related questions that we get. And we do depend on that Center of Excellence network for the ones that are more difficult. So a little bit about the patients that we serve. So we try to meet patients where we are. So these are all quotes from patients across their journey. A lot of them came from, we had an 8-year survey we conducted, so a lot of them came from that, also from patient newsletter submissions. So I want you to know all those surveys that we send out, I read them over and over again, and I pull out the data and find ways that hopefully we can make things better. So these are just some that stuck out to me. One is, I'm lost in acronyms. So MDS is full of acronyms, and we're trying to find ways to simplify that for everyone to speak the same language. The next one, it is helpful when patient information is offered in plain English terms, something the average person can understand. I very much empathize with that, and we try to write it in a way that kind of brings it down to where it's understandable. I've had to advocate for myself throughout this cancer journey, which is scary and lonely at times. So there are times when it's hard, right? And we would be naive to think that it wasn't, but hopefully we can make a difference when it is. Probably my favorite one is MDS does not define me. I always tell patients you can have MDS, it doesn't have to have you. And so we're trying to empower people so that that becomes a reality for everyone. And then the last one is anything that would take away my feelings of helplessness. Sometimes I just don't know what to say or do. And so that's kind of where we come in to help you know what questions to ask and get more information. So those are just a few. Patient resources, we have many printed materials. We are happy to ship them to you. They're always free of charge for our patients. I put the QR code on there, and like I said, you'll get these slides and can go there. We do have 20 translations across the board, so not everything is in every language, but a lot of them are in different languages. So Building Blocks of Hope is really kind of our handbook for MDS. It was developed in partnership with our Nurse Leadership Board. It's a lot of information, but broken down into digestible pieces. And it's basically everything you'd want to know about MDS. We also have that in AML and MPN. And then what does my bone marrow do? It's a great understanding of exactly how your bone marrow functions. Out of Shape was a story that's written by a patient who's gone through the transplant process. Understanding your MDS. So that talks about subtypes and risk stratifications. We have the newsletter that comes out twice a year, as well as the online newsletter that comes out once a month. We have a 100 questions and answer booklet. We have a glossary, like I said, to break down those acronyms. We have a visit discussion guide, which is very helpful because basically when you don't know what to ask, it tells you what to ask based on where you are on your treatment journey. So we're happy to send that. We have a guide to assistance that covers financial resources. Unfortunately, right now, we're not able to provide those, but we do give a list of every place we know of that does. And then support group leader toolkit. So if you want to start a support group, we are more than happy to help in any way that we can. So some of our online programs, we have several of those as well. We have a message board, which I hope to show you at the end. It's being used quite a bit recently. We have global support groups, and we desperately need more support group leaders. So if you're interested, please let me know. We do have patient and family podcasts that you can listen to, frequently asked questions page. We have a journey of empowerment, which basically takes you through MDS. It makes sure you understand at each step. It has knowledge assessments in there. Colloquy is essentially social media dedicated to MDS. And so we found a lot of people go on Facebook and put their personal health data, which is fine if you're okay with that. But for people that are not, this is a little bit more of a safe space. And so you can break it down into different discussion rooms and have conversations with other people in a similar situation. We are updating that. So version 2 should be available shortly. Quick note that we are also updating our website. And it's going to be much easier to navigate, much cleaner. Everything will still be there. It just hopefully will be easier to find. We also have downloadable apps for Android and iOS. So there's a picture of one there. PDF versions of printed material. So everything except for, there's a handful of things, but for the most part, everything online and everything in print is available online for you as well. We have You and MDS, which is a wonderful patient video. It includes expert conversations, patient information, patients talking to you, animated guides. So it's really great if you can check that out. We have that in Spanish as well. And for some of these things, we also have AML dedicated resources. We have an AML dedicated portion of our website because some of our patients do progress to AML. So we want to provide you with that information as well. So as far as live events, we have patient and family forums. It's probably one of my very favorite parts of the job. So we host about 6 per year. We do try to get 1 international in as well. Average attendance has been about 40 to 50, including patients, caregivers, family members. I'm always impressed by the distance that people travel to be there. We have people taking flights to come in. Not that we want you to have to fly that far, but it's impressive to see how far people come to meet other people with MDS and who know about the disease. We do hold these in conjunction with our centers of excellence. We need speakers and we pull them from there. We trust, their knowledge is going to be valid. And then most of the topics covered, we typically always go over what MDS is, high risk, low risk disease, some of the treatments, newer research, and then we do cover becoming a partner in your care, which talks about how to become an advocate for yourself. We also have live webinars. We host about 4 of those per year. You can view them online after. We do range from 50 to 100 or so registrants with those webinars. Topics are pulled. What's really important to know is the surveys that you guys complete. That's where we come up with topics. So everything that we talk to you about are things that you've asked about in the past or are looking to get more information on. So in that way, it's customized. So impacting patient care, we have 2 resources that I think really do impact patient care the most. The first being our Centers of Excellence program. So like Tracey said, we have about 200 that are worldwide. It's a rigorous process to be a Center of Excellence. So people ask why a second opinion and why a Center of Excellence. So why a second opinion is because we always recommend a second opinion. It's your health. It's never wrong to hear more than one person's view on it. And that way you can make a well-informed choice. So that's why second opinion. Why a Center of Excellence is because the knowledge and research that they put into MDS is significant. So I put the requirements so you can see they're they're established with a university or some type of equivalent. They have expertise in diagnosing MDS. They have cytogenetic and molecular genetic testing capabilities, ongoing research, and then they have to have peer-reviewed publications in the field. So they have to be knowledgeable about the past of MDS and be involved in the future. And so those applications come in, they're reviewed by a committee and accepted or not accepted. During the past 12 months, we have made referrals to 60 centers of excellence. And so that's exciting, definitely exciting. So if you're interested in that, let me know. And then Spark Cures is our other one that I have listed as really impacting patient care. So clinical trials, there's definitely a need there in MDS, but what people don't know is there's over 200 active clinical trials in MDS right now. And so we need to get the word out. And we did a survey that was 8 years long. For this question, we had 597 respondents. And in that, in that 61% said that they have considered participating, while only 13% had, and only 59% reported that their healthcare provider, or 59% rather, reported their healthcare provider had not discussed clinical trials with them. So basically, we saw a knowledge gap here. We partnered with a group called Spark Cures, and I'll show you their website at the end as well. The QR code is there. It's a matching platform. There's a patient and professional portal, so you can input information like your subtype, what treatments you've had in the past, where you wish to be treated, and it'll give you a list of customizable clinical trials. You can go and make an appointment with them. You can make an appointment with myself. We can help refer you to whichever center has the trial that you're looking for, give you the right questions to ask your physician about it, all kinds of resources that are much easier to navigate than clinicaltrials.gov. If you've been on that site, then I'm sure you will agree. So a little bit about our professional resources. So the first thing is membership. So we are making a big push this year for membership, and I listed the benefits first. So there is going to be a professional member discussion board that will be accessible only to paid members. It will be private and kind of the information locked down so that you can discuss ways to treat and bounce ideas off of each other. That's coming in 2025. We do have now membership requirements for Young Investigator Grant applications or abstract applications. So if you're looking to submit a grant or an abstract, you would need to be a professional member. We do offer free shipping of educational materials. So all the things that I've talked about before, you can request and we will ship to you for your patient so you can distribute them wherever you are. And then the Leukemia Research Subscription Discount, that is our official affiliated journal. And so it does come with a subscription discount if you select that. We do offer discounts to our professional programs that I will talk about shortly. And then receipt of our printed newsletters, which are really a wealth of information. They're newly divided into patient and professional sections. And I think they really do a great job of talking about what we've done as a foundation. It gives you some information on what clinical trials are out there and any published research, from our centers of excellence. So it's a great resource. And then if you are a professional member and you are a PI of a clinical trial that involves MDS, CHIP, CCUS, or secondary AML, we can get that onto that SparkCures platform that I talked about in an expedited fashion. It is manually pulled from clinicaltrials.gov, so at all points it's going to end up there, but if you want it there quickly, we're happy to do that for our professional members. A few notes. We, as of last year, developed a student membership, so that's great and a discounted rate because I remember very well being a student. And then it's open to all members of the multidisciplinary team. So physicians, pharmacists, advanced practice nurses, social workers, nutritionists, anyone who's involved directly in the care of these MDS patients is welcome to be a professional member, as long as you are in the healthcare world. And then there is a one-time or annual payment option available. So you can select a recurring payment or you can do one-time payments. So a little bit about the risk calculator. The risk calculator is one of our very most used resources that we have. We as a foundation worked with the International Working Group for the Prognosis in MDS, IWGPM, to develop the IPSSM calculator. We do have where you can access it online. There's a screenshot there. We also have a mobile way to access it, so you can download an app instead of having to go to the website over and over. We have that for iOS and Android, so definitely check that out if you haven't. If you are a patient on the call, you are also welcome to check that out, but do confirm your risk level with your physician because they might have some information that you don't have access to. Professional podcast. So the podcasts do a really good job of providing new information on MDS. We often cover the symposia like ASH and EHA and talk about updates that were pulled from that. So for people that miss those conferences, it's a really great way to get some insider information. We do about 4 a year, 1 per quarter, the same with our patient podcast. So a little bit about our professional education efforts. So we do an annual ASH Satellite Breakfast Symposium. Last year it was standing room only, and I felt like usher at a movie theater trying to get people seats. It was very well attended and we were excited to see that. So it is CME accredited. We have information available online, and following the event, there's information online as well. We also have the Biennial International Congress on Myelodysplastic Syndromes. So what's interesting about this one is it does offer a scientific and a nursing pathway, which I think is great, especially for our Nurse Leadership Board. Provides an opportunity for global networking, and I put the top 10 participating countries there, so you can take a look at that. That is coming up this year, so we will be, or next year, sorry, we will be in Rotterdam in 2025. I put the dates there, mark your calendar. I hope to see some of you there. And then in alternating years, we do the regional symposium on myelodysplastic syndromes. The last one was in Kyoto in 2024. So that was in March of this year. We had 199 registrants and 20 countries represented. The symposium webcasts were posted for on-demand viewing. So those are very well attended. So a little bit about research. Tracey talked quite a bit about our Young Investigator Grant. I'll give you just a little background. It was initiated in 2005. I have a number of 550,000 that's been distributed. I think that's more closer to around 700,000 now. They do provide investigators the opportunity to initiate, continue, or complete a project that focuses either basic or clinical management into the causation, epidemiology, molecular biology, cytogenetics, morphology, prognosis, or treatment of MDS. So that's a mouthful, but basically anything to help, we're working for a cure, right? So that's what we have available. And then if you want to be notified of upcoming grant cycles, I have the QR code there so you can join our email list. And then a little bit about our partnership with pharma, which is one of the things that I was most shocked about and happy to see. So our job as an advocacy organization is to make sure that the patient voice is at the table in all things, including research and drug development. So these are a couple of the things that we do to ensure that. We do roundtables and advisory boards. So we host and facilitate them. We get a group of patients together that meet the parameters. Say we're looking for a group that's transfusion dependent or a group that's watch and wait. And we talk to them, right, about their experiences and what's important to them. And then patients who participate in that agree that that information can be shared with the pharmaceutical company, who then uses that in their drug development to know what's really important to patients. We also have consulting opportunities. So I spend a lot of time going through patient-facing documents from clinical trials to review them and see, are they patient appropriate? Do they make sense? How can we make that in a way that's easier to understand? And how can we avoid deviations on those clinical trials? Because ultimately we need good data for drugs to get approved. And then also patient recruitment. So there's a lot of efforts that are going on right now that are very focused on the experience of both the patient and the caregiver. And so a lot of quality of life assessments are going on by different companies. If we feel that that's valuable to our community, there is a vetting process, then we will pass that on to people. They do often, or actually almost always, offer an honorarium to our patients who participate, because we do appreciate the time that it takes you to do those things. Typically they are a survey or a Zoom call, and we can also recruit some patients to review documents from pharmaceutical companies as well, such as consents or pill diaries, education packets for new drugs. So we definitely want to get the patient perspective out there. So these are a couple links I wanted to show you really quickly, and hopefully it works like it's supposed to. So the first is the patient message board. That will pop up for me. Okay, so this is kind of what it looks like. We are getting a new website, so the background may change, but the rest of it will not. So you create a login and a password. If you don't have one, then you register. And then this is kind of, there's the register button. Message board home, you can see we have over 254 pages of patient messages. You can see our recent topics there. There's quite a few. There's a lot of conversation going on right now, which I love to see. I really don't get involved in this unless I'm correcting data, like if something's blatantly incorrect, or if there's some way specifically that I know as a foundation we can help, then I do try to put that out there. Otherwise, I leave that to you guys. I can provide a lot, but the patient experience I can't provide. So that is the goal in the message board. Our material order form, so this would be for professionals. Now, if you are trying to order, or professionals and patients rather, if you are trying to order bulk items, please email me, because this one will only let you select a small number at a time. So if you click order now, you go through the process, it'll ask for your name, address. Do put as much information in as you're comfortable with, because we use that information to be able to talk to you, tell you about upcoming events, and it will also let you know what languages you can order in. So it's pretty self-explanatory on kind of what's there. And what's always fun is we do give out these red blood cell plush toys, which are great. My children have many of them. So if you want to order those, they are free of charge as well for our patients. The next link really quickly. So this is going to be our risk stratification calculators. So it does have the link to where you can get the app as well. So there's IPSS-M, IPSS-R. And so if you click on these, which the app may be a little easier depending on where you
Ashley,
practice.
I'm sorry,
Yes.
it's Janice. I just wanted to let you know that we're not able to see that when you're clicking on those links.
Really
Yes.
interesting. How do I do this? Let's see. Well, I'll send the links out. How about that? Because I
Okay.
don't know how to
Yeah,
make it work.
We'll include them in the email that goes out to all registrants.
Yes. I did want to show Spark Cures though, because that is patient facing. So let me see. Let me stop sharing and then I'll pull it up again. I promise we tested this out, but sometimes, you know, things still happen. Okay, let me go back to sharing. And then you can tell me if you can see it. Can you see it now?
Yes. I can
Okay.
see it.
So I still have these open, so I'll just show you real quick. This is what the message board looks like. So I'm sorry you couldn't see it before. The register button, message board home, where you log in, and you can see it's very active. So we're excited about that. And then we also have, this is the material order form. So once you click the link to order, there's the picture of the red blood cells I was talking about. You can click what material you would like to order. So that's kind of what that form looks like. Additional tools. So this is the IPSS-M calculator that comes up. You put in all this information on the left. So cytogenetics, molecular data, bone marrow blast, and then it will pop up with information here that kind of tells you which category you fall into. For any patients on the call, if you don't know your category, your subtype, or your risk level, definitely ask your physician. Not all MDS is created the same, and they can be treated very differently depending on what this number is. And then if I can just get to the Spark Cures. Okay, so this is the patient portal for Spark Cures, and as you can see, there's a little bit about us, a little bit about MDS, and kind of how you get started. You can search by center. So if you click on centers, it'll pop up here. There's map options. There's filters on the left. If they are an MDS Center of Excellence, that is notated on here, and it will tell you how many clinical trials are ongoing at each facility. You can search by trial if you know what you're looking for. So here you can put in purpose of the trial. There's lots more filters if you pop it up, so you can go through all of those. And then it will tell you kind of, where you can learn more. So say this is the one I was interested in, I would click on it, and then it gives you even more information, like what's, am I eligible? You can click this button and kind of go through what that eligibility looks like. You can fill this form out and it will tell you yes or no. Obviously, it's not a guarantee, but it does really help to narrow it down for you. So there's a lot more into Spark Cures, but as long as you can get to the basics and find the chat button and schedule an appointment if you need help, then you should be good to go. So yeah, that's a little bit. Let me just stop sharing. A little bit about what we offer. I feel like we offer so much more. We have upcoming projects coming in the next year. We're going to have one focused on anemia and why that matters to really work that up, and one on disease progression. So myeloid malignancies are a spectrum. So we're going to go over that from like beginning to end. So those are two of the projects I'm really excited about, and hopefully there'll be many more to come. Sorry that you couldn't see.
Thank you, Ashley and Tracey. Appreciate it. Great presentations. If you have time for a couple questions. Our first question is, I guess this goes to Ashley because it's regarding our centers of excellence. How long does it normally take to get an appointment at a center of excellence?
Yeah, so for every center of excellence that we have someone that we call a PI, our principal investigator there, and we have their contact information. So the way that typically works is I will reach out to them and have them reach out to you for an appointment, or they will give me information further for you to schedule an appointment. What's important about if you go that route, then there's some level of accountability, right? Like they get busy, but I'm going to follow up and say, hey, did you get this done? And so like it or not, they're going to hear from me. And so I think that typically I get an answer in about 48 hours. And usually we get patients in within the month, and it does vary based on how stable your counts are.
And Ashley, what does the patient need to provide in order to get that second opinion? Do they need to send anything to you or?
Yeah, so I don't want your medical records. That sounds bad. I would love to talk to you about them, but we're not really in the HIPAA compliant world as like hospitals are. So really the information that I share with them are a brief synopsis, your name, contact information. What I will say though, is that your current physician will have to give all those records, a copy of them, to the Center of Excellence. And so that's something the Center of Excellence can help facilitate. They usually reach out directly themselves. But as far as what you need to give to me, just a synopsis and a way they can contact you.
Okay, thanks, Ashley. Another question is, are all your printed materials available online?
So yes, with the exception of, I believe Out of Shape, actually it is online now. So 100 question and answers is the only one. We have a limited number of those that are available online that we can give you a code to access the online book. But we do have quite a few available right now. So everything else should be online.
Okay, thank you. How do I find an MDS doctor near me?
You want me to take it, Trace? I don't know. I don't know who's taking what. But
Yes,
okay.
I would like you to take anything having to do with finding a doctor.
Gotcha. So contact me is the first step. If I'm happy to help you work through that. So we have centers of excellence. Unfortunately, we don't have them in every state. in case we're trying to grow that program as well. But in cases where we don't, what I do is reach out to physicians who are affiliated with centers of excellence nearby and say, who is in that area that you talk to and that you would trust to send a patient to. So I try to get referrals that way, even though they're not directly a center of excellence, they've worked, in conjunction with some of our other investigators. So that's kind of how it works best, in my opinion. But just because that way you can know that somebody's worked with them. It's hard to find local physicians sometimes, local hematologists.
So we have two different questions. Someone is asking any centers of excellence in Bulgaria, and how about a center of excellence in France? So
There's
I
several
think
in France. Yeah, go ahead.
I was
Sorry.
just saying explain how you go about finding where we have them on our website.
Yeah, I will share my screen if that's okay. So you can see our map. So if you go to our homepage, now this is going to change a little bit when we get our new website, but there will still be a Centers of Excellence link. So you can find the Center of Excellence link, professional and patient, it'll both take you there. So if you click down here, Centers of Excellence, and then it gives you an overview. But then if you go to browse our centers, and this is up to date, I updated it when I started in this role. So these are going to be United States. These are going to be international. I don't believe we have one in Bulgaria. We do have several in France though, and we do work pretty closely with them. So there's a list of all the France, and it works the same with international referrals. So if we've helped people in other countries definitely get in with our centers of excellence over there. So anywhere over, not in the US. So let us know and we can try to help you with that too.
Okay. The next question is, I was just diagnosed. What is a clinical trial?
Yeah, so I'll tell you what a clinical trial is not first. So you're not a guinea pig. And I think that that's often the misconception. So when I started in clinical trials, I really didn't understand it either. But what it is essentially a way to test medication that's been proven in preclinical, which means outside of human use for a certain type of disorder, to see if they can get it on the market. So for MDS specifically. Now, there are different phases of trials, and we do have a lot of information on that on our website. We also have a pre-recorded webinar from the group at Spark Cures that do a great job breaking down what a trial is. But a quick overview. So phase 1 test to see if it's a safe medication. Phase 2 test to see if it works on what it's supposed to do. And phase 3 is, does it work as well as what's already on the market? And phase 4 is long-term testing after approval. And so basically, just some quick things to note is that a clinical trial is completely voluntary. Even if you sign up for one, you can stop at any time. If there's something better that comes along for you, or your disease is not responding, or if you have side effects to a clinical trial medication, they will not keep you on it. They will find something that works for you. Your response does determine how long you're able to stay on the trial. So those are just a couple of quick what it's not and what it is, but basically it's medication that looks promising that we're trying to get out there to, the population of MDS patients at large. We've had 2 FDA approvals in like the past year, so we are excited. And like I said, there's over 200 available right now in the US. There's more.
Thanks, Ashley. I just want to remind everybody, please submit your questions for Ashley and Tracey through the Q&A button on the bottom of the menu bar. And our next question is, what is the difference between M and R on the IPSS calculator?
I can take that one if you want, Ashley.
Yeah.
Okay, so originally it was the International Prognostic Scoring System. And it, as Ashley mentioned, it determined your prognosis for MDS. So it started as the IPSS, and then a group of physicians called the IWGPM, the International Working Group on the Prognosis of MDS, got together and they revised that calculator so that they could be more accurate. And then when they did that, they realized that more information could be added to the calculator to make it even more accurate as we start to move into the area of more personalized medicine. So they added M. So R is the IPSS that's been revised, and then M is the IPSS that includes molecular information.
Thanks, Tracy.
Yep.
My doctor said MDS isn't a cancer. Is it?
So there was a time that we did not consider it a cancer, but we do now. So we do say MDS is a blood cancer. It falls on, like I said, myeloid malignancies, which include AML and MDS and CHIP, CCUS. They all fall on a continuum. But we do consider MDS to be a cancer. We also understand why it's called syndromes, because there's a lot of things that come along with it, right? The fatigue and all the symptoms that come with MDS. And so I don't think it'll ever be called anything other than myelodysplastic syndromes, but we do categorize it as such.
Thank you. And somebody's asking for your contact information, Ashley.
Yeah. Let me see if I can put it. Can we just put it in the chat? Would that be helpful?
Yes. We can put it in the or I was going to say we could just say it's 1-800-637-0839 extension 210 if you want to talk to Ashley. That is her phone number.
Yeah.
An email address too would probably be helpful. So
I put it in, but it went to host and panelists. So if somebody that has access can transfer that over, I'd appreciate it.
Perfect.
There is a patient liaison email as well. So it's on the website. If you can't, that does come to myself and Janice. So you're welcome to message on that one. I think messaging my personal one is a little faster just because the other one, I get a lot of junk mail through that too. So might be faster.
Do you have any volunteer opportunities? And if so, how can I get more involved?
I'll let Tracy.
Yeah. We do have a volunteer sign up on the website, and we collect that information. We ask what it is exactly that you would like to do and how you want to work with the foundation. And that information is collected. And if we're in the area having an event or something, then we might reach out. There are other times where volunteer opportunity is to be a patient leader at for a support group. Or also to review some materials that like the protocols or something that our pharmaceutical partners are creating and really need a patient voice before they finalize it. So there are quite a few ways, and we're definitely interested in working with folks who want to work with us.
Okay, thanks, Trace. I think Tracy just touched on this, but somebody's asking, what is the latest scoring system?
Yeah, that's the international, that's the IPSS-M, so the molecular scoring system. And it's actually, it is a very popular calculator. It's one of the, it's been historically the most viewed page on our website. So it's definitely being used. And I know that, and Ashley can touch on that a little bit, why those scores are so important.
Yeah, so a little bit on why they're important. So they determine, and again, we can't really give anyone definite answers on number of years or time, right? But it gives us somewhat of a ballpark on high risk to low risk on your risk of transitioning to acute myeloid leukemia, because our goal is to delay that progression. At present, the only cure for MDS is going to be stem cell transplant, right? So in treating that MDS, a lot of our goal is really to keep it from progressing. And so the risk calculator kind of puts you into a category. There does spit out a number of like time associated with that, but just know that that's number one, it's time if you didn't get treatment at all. And number two, it's nobody can give you answers for sure, but it's nice to have a ballpark.
Okay, and Ashley, this next question is for you. So how often does MDS turn into leukemia?
Yeah, so right now the statistic is about 30% of patients with MDS will develop leukemia. Often it's the patients that come in with high risk disease, but that's still just kind of the overall statistic.
Okay, thank you. And how do you go about finding a support group?
Yeah, so right now we do have people on the website. What I will say is some of them since COVID have not been quite, we've kind of taken a hit, I guess you could say, on our support groups, just because meeting together has been difficult. So a lot of the ones that we have now are going to be virtual. And so you can go on there, you can contact me and let me know. I'm happy to tell you which ones are more active. Our national international group is very active. It's led by a patient and he does a really great job. And then we have a couple others like a coping and caring group that's virtual. That's also really well attended and she does a great job. So you can look on the website, but let me know. I'm happy to let you know which ones actually meet on a pretty frequent basis.
Okay, so the son of the patient that lives in Bulgaria, he wants to know, can a center of excellence give a second opinion remotely? He can provide the translation on his father's medical records.
So technically, the answer is typically no, because they like to see the patient, especially for the initial consult. What I will say is there's a couple of our centers of excellence that have international programs. So they have people dedicated on helping you get everything you need set up to come to a different country for that. Also offline, our physicians will help you as much as they can. They can't give direct medical advice, without seeing you per se, but they definitely can help point you in the right direction or help as much as they can. So I have physicians who are willing to help, but an official formal second opinion would have to most likely be in person or at least in the same country.
Okay, thanks, Ashley. And these are kind of like two questions I'm putting together, but what is a stem cell transplant and what is the best cure for MDS?
Yeah, so stem cell transplant is officially the only cure for MDS. And what it involves is essentially wiping out your immune system. After you get your MDS under control, then they can wipe out your immune system and replace it with someone else's. It sounds kind of intense, but the process itself is kind of anticlimactic, right? It looks like a blood transfusion. You get stem cells from a donor that go in. There's a lot to consider with that, though, because your body, there's an issue with graft versus host disease. It can reject it and things like that. And there's also you have to be pretty healthy going into that. So it's a conversation definitely to have with your, doctor on whether or not you're a candidate for it and kind of what the long-term consequences are of a transplant. But essentially, in the most simplest terms, it's replacing your stem cells and your immune system with someone else's that we hope, will then then grow healthy cells, right? Where yours didn't. So that's in a nutshell what it is.
Okay, thanks, Ashley. How can I donate to the MDS Foundation?
Oh, I can take that one.
Yeah.
First of all, that's such a nice question. Thank you for asking it. There is a donate button on the website. So you could donate through there. You can also mail a donation to the foundation at our mailing address, which is available on our website. We could also put it into the chat if that's helpful. Our team member is Tanya Rhodes, our Director of Development. Reaching out to Tanya, she could also help you with any sort of information regarding donations or options regarding donations. And that is Tanya Rhodes, Rhodes. So maybe Janice or someone can throw that into the chat as well, a way to reach out to Tanya. And have I missed any ways to donate, Ashley?
I don't think so.
Thank you so much again.
Exactly.
Tanya's the best one to answer that question, but I know that those are the three ways that you can get that information. So thank you again for asking.
Okay, and the next question is, what is the best place to find resources like existing and novel medications for MDS efficacy and safety?
I can say, so on our FAQ list, and we just recently updated it, so it should include every FDA approved medication. There is a list of treatments broken down by treatment category. And I think that's probably the most comprehensive list that's currently out there. And then as far as clinical trials, you can do Spark Cures to see what is out there. But if you're looking for, published data goes to clinicaltrials.gov. It can be hard to navigate. So what I would do if you're looking for up and coming, we have a podcast that covers, we had physicians go to EHA and ASH, which are the big conferences on hematology clinical trials every year. They did a patient level summary of what they were most excited about. And so if you're interested, those you can watch those, and I think, or listen to those rather. I think those would be good. Then Tracey, I'll let you if you know any other.
No, I think that's perfect. I mean, obviously contacting Ashley, she can help you find what you're looking for if it's something more specific, but yes, those resources should be really helpful.
Okay, thanks. And a question for Ashley. What is the most challenging question that you have received from a patient?
That's funny. I've received a lot. So to any patients on the call, just know if I don't get back to you instantly, it's because I'm probably researching someone else's question too. So there's a lot of them. One was, does formaldehyde cause MDS? So exposure to chemicals. What's the link between the COVID vaccine and MDS, and or COVID itself and MDS rather? And I've gotten a lot of questions actually on altitude and anemia. So that one was interesting and took some research just because it's not as well talked about, I guess. And then some really off the wall questions. So if you're interested in those, I can let you know offline. But those are probably, yeah, basically people really want to know what causes MDS, right? And I wish I could say this is what caused your MDS and there was a way to pinpoint that. All we know right now are risk factors and what puts you at risk for it. Often it's aging, as you get older. But yeah, I think a lot of questions around causes.
Okay, and here's another one for you, Ashley. Do patients sometimes get more than 2 opinions on treatment? And what is the most important factor in staying with a healthcare team that is best for you?
Yes, so you should be presented with every option, right? And it doesn't mean that you're a candidate for every option, but for any options that you are a candidate for, you should have the ability to read it, to talk about it, and to make a decision. And so as far as staying with the healthcare provider, you need to be able to talk to them, right? They need to have a genuine interest in what you're saying and what you want and what your treatment goals are. So if you think that's not the case, then may be time to find somebody else. But you need someone you can work with as a partner.
Okay, great. Thanks, Ashley. If you have any more questions, please submit them through the Q&A function. And what's the best way to explain MDS to your family? A lot of
That's a
people
really
don't
good question.
understand what it is.
Yeah, that's a great question. And Tracey I'm sure she'll have input here too. But I like to break it down based on what MDS, the word itself. So myelodysplastic syndrome. So myelo meaning bone, right? Your blood, bone marrow. Dys meaning it's not doing something right, and plasia means to make. So essentially your bone marrow is not making cells correctly. So if you break that word down into the 3 things that make myelodysplastic syndrome, that's what that means. There's 2 really good analogies that you can use. The one is a factory. So if you consider your bone marrow to be a factory and it produces cells, right? The red blood cells, the white blood cells, and the platelets. Those are the 3 we're most concerned with MDS. It's like, an automobile, right? It's producing parts, but if it's producing faulty parts, then that's not really, it's not going to serve you well. So that can be part of it, like a breakdown in the machinery. The other can be a garden. I hear that one a lot. So your bone marrow grows cells, it grows these flowers, right? But then it gets tainted by these weeds and it starts growing. You have to go in and weed out the cells that are not functioning. So that's one. And then for blast cells, my favorite one. So blast cells are immature stem cells. They don't grow up, they don't do their job, they get stuck in that place. And so in MDS and into acute leukemia, your body will have too many blast cells floating around that just really don't ever go on to do their job. And so what I like in that too, because I have teenagers or a bunch of teenagers at home that don't know what they're going to do in their life and they just stay there and you can't get rid of them. So that's my definition of blast cells, right? That they look into. But essentially, if you break the word down, it's easy to explain is that your bone marrow is not making cells appropriately. And then, that's where all the problems come in based on which ones are not being made appropriately.
Okay, thanks, Ashley. Great explanation. And do you have any resources? Does the MDS Foundation have any resources on holistic treatments to go along with the medicines?
You want me to? It's up to you, Tracey.
I sure do. That's all you.
Okay. I wish is the short answer. So it's a goal for 2025. I would love to have a webinar on it. And I've reached out to people. I have a hard time getting answers back. What I do know about the holistic medicine is that there's just a lot to learn. But if you're on vitamins and you're on things like that, do herbal things. Let your doctor know, because what I do know is that some of that can interfere. And things like acupuncture, that can be great, but if your platelets are low and you're going to bleed, then maybe that's not the best. So most physicians are not opposed to you trying the holistic treatments. They just want to make sure it doesn't cause problems with what you're already on. And we really do. If you know anyone who's willing to speak for us on holistic MDS treatments, I would love it, because I'm having a really hard time finding someone.
Okay, thanks, Ashley. Lori said that she had chronic carbon monoxide poisoning for over 400 days in her home under the detection of a carbon monoxide detector. Can this activate MDS? And
I don't know that. Oh, sorry.
And
I
it
didn't
says, if
realize.
you don't know, can you help in finding a specialist in her area of expertise? So that's maybe something you could talk to Lori about privately, but can that actually activate MDS?
So definitely would be happy to look it up. It will take me some time, like I said, to look it up if I don't know offhand. What I will say is there's an interesting study that was done around 9/11, and they found that the firefighters there who worked on 9/11 and the cleanup and recovery efforts had a greater chance of cancers, including MDS. So we do think there's a link between exposure and development of MDS, and I'm sure there was CO2 there. The problem is we don't know which one, right? They were exposed to a lot of things. And so there's a couple of chemicals out there like Agent Orange and things like that that we know are directly linked. And even that's a battle for insurance. That's a different story. But as far as carbon like dioxide, I would have to look in specifically, but there are environmental things that can put you at risk. But yeah, definitely send me a message and I'm happy to help.
Great, thanks, Ashley. What is referred to as the 3 lines of dysplasia?
Yeah, so the 3 lines we worry about are white blood cells, red blood cells, platelets. So when a stem cell starts out and comes into the world, it's like a little baby cell and it doesn't know what it's going to do with its life. And then it picks, right? So it's going to pick white blood cell, red blood cell, or platelet. So if there's dysplasia, which means those cells are being made improperly or you're not making enough of those cells, then we call those cytopenias. Those cells lines are lower than what we expect. So if it's your white blood cells, then you would think, risk for infection. If it's red blood cells, you would think decreased ability to carry oxygen. If it's platelets, we worry about risk for bleeding. What I will say is there's different categories of MDS depending on how many lines of dysplasia you have. So that's a conversation to have with your physician because it depends too on how many did you start with, because some can evolve over time. But it can change your category of MDS depending on what you started with. So like single lineage dysplasia only affects one, right? But if it's multi-lineage, then it can be any of them.
Okay, thanks, Ashley. And Lori has another question about what is included in your program with regards to nutrition.
Tracey, you want it or you want me to?
Well, right now we are just starting out in nutrition, so we do have some partners and some friends that work really hard on the nutrition side. So we are planning a webinar for next year in partnership with that group to work on a nutrition program, and to potentially even have a nutritionalist speak, at support groups or, help us with expanding what we don't have on the program right now. But right now, Ashley can connect you with some really good information on nutrition if you contact her.
Yeah, some of it's outsourced, but we definitely even if we can't provide what you need, then we try to get it somewhere else.
Yeah, I think our patient forum slides, if you do attend a patient forum, the nurses, speakers that speak at those events touch on taking care of yourself, and a big part of that is nutrition as well.
Okay, thank you. And what is the criteria to decide if Aranesp treatment is working or if it is effective?
So there's the main criteria are going to be rise in hemoglobin and decrease in transfusions. And I don't want to say the rise in hemoglobin that I think it has to be, because I could be wrong, but there is a very specific number at which it has to rise by, based on your baseline counts, and then number of transfusions that you're getting in between.
Okay, thank you, Ashley. That is all the questions we have for today. If anybody has any last minute questions, please go ahead and submit them through the Q&A button.
Janice, I just wanted to say too that as Ashley was going through her explanation of our programs, I neglected to thank the partners that we work with on those programs. That is another reason why we're able to do what we do, is because we have amazing agency and vendor partners that help us with our animated videos, or also with Colloquy and Joe and the resources that we're able to do. This webinar, for example. These partners have been fantastic in helping us, because they do a lot of the heavy lifting, and then we're able to do what we do best, which is focus on the patients and the MDS. And obviously, out of the two of us, Ashley's the one you want to talk to when it comes to any question about your MDS care. You know how to get in touch with her. And I wanted to just thank you, Ashley, for all of your great help and information on the webinar today.
Well, Tracey sells herself short, because she's equally as competent, if I'm not around. So yeah, she sells herself short. But yeah, basically,
Thank you.
we exist for you guys. We exist for patients. We exist, well, primarily for patients, but we also exist for the professionals that are out there, for the companies that are working hard to find a cure. So if there's anything we can do that we're not doing, happy to listen.
Absolutely.
Ashley, one more question did come in, if you don't mind answering it.
Yeah.
What is the prognosis from stem cell transplant?
So I hate to give it varies answer, but it varies, because so if you're getting worked up for transplant, there's a calculator, and they put in the health of all your other organ systems. So cardiovascular, your GI system, your lungs, and it spits out a specific number for you. And they use that number to determine, is the risk of transplant worth it? And kind of go from there. But that should give you a more customizable number. Now, what you can do, and I have there's a website online that you can go to each transplant center, and I can share it if you're interested, but message me offline. Each transplant center to see how many transplants they do and what their survival looks like at 1 year post, or, like that information is publicly available. But really and truly, it's dependent on what you look like as a patient. And your doctor should go over a calculator with you and kind of be able to tell you what your risk is.
Okay, great. And then there's a question asking, will we be sending a recording of the webinar? Yes, we will. Everybody that registered for the webinar will receive an email from me with a link to find that webinar for on-demand viewing on our website. And it will also be available on our website for on-demand viewing. So I guess that concludes the webinar today. I want to thank Tracey and Ashley for your wonderful presentations. And like I said, the presentations will be available on our website within 10 business days. We appreciate your feedback. So please keep an eye out for an email from me with a link to a survey, letting us know how we did. And this concludes our webinar. So thank you, everyone, and have a great day.
Thank you.
Thank you.